I have had to go to a couple of depositions already. This area is so happy. What's up guys, welcome back to my channel. My name is Lori. If you are new here, I am a family nurse practitioner, and in today's video I want to talk with you guys about 5 things that you should know before you accept that job as a new nurse practitioner in a nursing home setting. If you guys are new to my channel, I am a nurse practitioner and I work primarily in a nursing home setting. I do round in a hospital 1 weekend a month, and I also do wound care as a specialty, but my primary job is working with the patients in a nursing home setting. One of the things that you should know if you're a new grad and you're going to accept this job in the nursing home setting is the amount of red tape that you are going to have to cut through when you make any decision for your resident. Yeah, any decision. If you're a nurse practitioner like myself who's never worked in a nursing home setting, once you start working there, you're going to realize that this is a whole different world than the hospital setting. The DONs, the MDS nurse, the corporate nurse, there's so much people that is coming at you at different angles saying, well, do this or do that, or can we do this? If you don't have a strong head on your shoulder or a strong backbone, you will go crazy. They will run you ragged. When I first started this job, the first 3 months, I was like, oh no, I'm out. I am out of here. One of the things my boss actually said to me in my interview was, if you can handle the phone calls, you'll be fine. Number 2 that you need to know if you're going to accept the job in a nursing home setting is going to be the amount of telephone calls that you are going to be getting. Because if you are working for a physician, I'm not talking about if you're working for a big group and there's multiple physicians and multiple NPs or PAs in that group and you guys rotate around and you can substitute one day for this one. I'm not talking that. A lot of new grad NPs get a job with one physician and it's just one guy and he has an NP and it's just both of you. 9 times out of 10, once you get acclimated to these nursing homes, the nurses are not calling your boss anymore. They're only calling you. They prefer to deal with you. And the phone calls are never stopping. They just come, they come, they come, they come. It is crazy. Even one of my friends, I ran into him like a couple weeks ago. He just got a job in a nursing home setting working as an NP, and he said to me, you know, I seriously have anxiety, and I didn't have anxiety before, but I swear I have anxiety because of the stress and the amount of, you know, phone calls and things that I get. Number 3, as a new NP or as an NP in general, I feel as if you are more open to a lot of liabilities than you were as a nurse. I started working 2.5 years ago and I work in a nursing home setting, and I will tell you guys that I have had to go to a couple of depositions already because this area is so happy. I don't know, I think America on a whole is so happy and trigger happy to sue. They sue for everything. It is a open season for you to be sued or the facility to be sued, and then you are kind of thrown into it because you're the provider. So I will tell you, make sure that as a new grad NP, or not even new grad, period, new grad or old, in between, it doesn't matter. Make sure your documentation is A1 and make sure everything that you have said that you're going to do, you follow through with it. Because when I tell you, when these people, family members, different folks always call the state and complain, state will come to investigate and they're going to dig through everything. It's open season. They will call you and ask you questions and you're like, I don't remember that. That was a year ago. This actually happened to me. I'm telling you guys this from experience. And I'm saying, what? I have to look at my progress note. Luckily, I had documented, I had a paper trail of what the things that I was saying that should have been done with this patient. I won't get into specifics, but I'm telling you, this is a open season for you to possibly get thrown into these lawsuits and different things like this because you are the provider, you're in that space. Number 4, I will definitely tell you guys that be very, very careful of the physician that you choose to work with when it comes on to getting a job as a new NP in these nursing home setting. A lot of these physicians, I'm telling you, a lot of them don't have a good reputation, and I know that because it's so difficult for NPs to find jobs, you kind of just want to take the first thing that you get. If you can do any kind of research or anything, do your research before you take a job with some physician, because some of them don't have good reputation throughout a lot of these nursing home settings, and then you are coming along and you're kind of being associated with them, and it's not a good look for you. The next point that I want to share with you guys is that if you are going to accept a job in the nursing home setting as a new grad, get yourself a mentor. Period. Get yourself a mentor. A lot of these physicians, I'm telling you now, a lot of them don't care about you. That's just the truth. They don't care about you. They don't care about your growth and your development. They don't care. They want to optimize how many patients they can see and optimize their bank account. That's why they're hiring you, so they don't care. A lot of them just hire you and then they expect you to run like robots and run crazy. Even if sometimes you have a contract with them and your contract says one thing, they're expecting you to do something else. And sometimes you get thrown into a situation where, well, this is not what my contract said, so I'm not going to do that. And then they're like, well, you have to do it or they'll threaten to fire you. I'm telling you guys these things from friends of mine and folks that I have known that's been through certain things with some physicians. And you get into a situation where you're saying, okay, well, I don't want to say no, but this is not a part of my contract and I don't want to do this. And a lot of times I think that they use these tactics because maybe sometimes you're going to say, you know, I'm just going to go ahead and do it because I can't find anything else. Or you think that you don't have any recourse to say, well, take me to court because this is not what my contract says. And a lot of times the NP probably is not going to do that. Becoming a nurse practitioner is not all rainbows and butterflies and, you know, it's going to be so laid back and I'm going to sit down now because I'm not humping in the hospital anymore. I tell people all the time it's a different type of hump. It is not physical hump, but it is a mental hump. It is sometimes a stressful hump, and some of the things that you think about, well, I know I do because I'm more susceptible to certain things that I didn't think I was as susceptible to when I was working as a nurse in the hospital setting. It's a different level of stress. It's almost like I'm always working. I will say that mentally, if you don't have it all the way together, it can break you down. It can put you in a state of, oh my God, this is too much. But if you're a new NP and you're going through this, I promise you it will get better, because I was there the first 3 months, child. I was like, I'm out. I'm done with this. I'm not about to be doing this anymore. I am not about to be doing this anymore. I have those days today, and it's 2.5 years later. I just wanted to make this video. Nothing is trying to be negative. I'm not trying to tell you not to be an NP or to be an NP or whatever it is. I share my experience and I give full transparency over here on this channel, because I do feel as if sometimes folks sugarcoat certain things and make it and put a pretty red bow on it, and they think that this is what is going to be and this is what's going to happen, and that's not always true, especially I think in a nursing home setting. I can only share with you guys this nursing home experience, and because I do realize that a lot of my FNPs, this is where we're getting hired. We're getting hired mostly with like one primary care physician, one internal medicine physician, and we are thrown in the lion's den in the nursing home setting. You guys kind of need to just be mindful and have your eyes open and your ears open, and make sure you dot your I's and cross all your T's. I wish you guys all the best. Thank you guys so much for watching. Do not forget to like the video if you do, subscribe to the channel if you wish, and I will catch you guys up on my next video. Bye guys.